Good morning. This is your intramuscular injection skill section. This is your patient, Emma Hardgrave. You are in a hospital setting and you've been required to give Emma an intramuscular injection of cyclazine. All your equipment is ready. The tray and your trolley is being cleaned with soap and water in the last 24 hours, and it's also been cleaned with clean and wipe. It's not required to do anything else. It's ready for use.
Okay.
Do you have any questions?
Yes, do you have a prescription?
I do. This is your prescription for today, and it's been prescribed.
Okay, so I can see my patient is Emma Hargraves. Great. Thank you. So,
Are you ready to start?
yes, I am.
And the time start now, 12 minutes.
Before approaching my patient, I'm going to make sure that it's safe for me to approach. I'll close windows and doors and curtains to maintain my patient's privacy and dignity. And I'll do my hand hygiene following the World Health Organization 7 steps. Palm to palm. Back of the palms, fingers interlaced. Fingers interlaced. Fingers interlocked. Thumb rotation. Tips of the fingers. And wrist rotation. I'm happy to approach my patient. Hi, good morning, Emma.
Good morning.
My name's Tatiana. I'm one of the nurses looking after you today. How are you feeling?
Nice to meet you. I'm feeling okay, not too bad. I'm just a bit nauseous.
Oh, bless you. So, good news. I'm here to give you your injection for your nausea. Is this a good time for me to do this?
It is a perfect time. It's approaching lunchtime, isn't it?
It is. Brilliant. So before I do that, I just need to confirm that I've got the right patient. So what I need you to do, will you just tell me your name and date of birth, while I just check it with your wristband as well?
Of course. Emma Hardgrave, 26963.
Okay, and I can see your hospital number is K95236674, Emma Hargraves. Okay, so all the details match. Emma, are you allergic to anything?
No, I don't have any allergies.
Brilliant, and you got a right wristband on, so that's good. So like I said, I'll be giving you your IM injection cyclazine. Have you had this before?
Yes, I think so.
When's the last time you had it?
Yesterday.
Yesterday. Where did you have it?
I had it in my right arm.
Okay, so shall we give in your left arm today?
Oh, yes, please.
Brilliant. So I can see your side, so I don't need to expose that. So are you alright if I just go and prepare my equipment?
Of course, yes.
I'll leave you your call bell with you, so if you need anything in the meantime, just use that, but I shouldn't be too long. Is that okay?
That's fine, nurse.
Brilliant. So on leaving the patient, I will do my hand hygiene. I won't be long, Emma. And I'll prepare my injection. So before preparing my injection, I want to check my prescription chart. So I can see it is not prescribed on the once only dose. It's prescribed as a regular drug. We have cyclazine, 50 milligrams 3 times a day, IM, for 5 days. Prescriber's signature and bleep number, print name are there. And it is due now at 2 o'clock. Pharmacy check has been done. So I'm happy to give this drug as it's a valid and legible prescription. And it is to be given for nausea, and Emma's complaining of nausea. As my tray it has been cleaned with Clean wipes, I don't need to clean it again as it's ready to use. I will now prepare the equipment that I require for the procedure. I will need a 3 ml syringe. Packaging is intact and it expires 1/12/2024. I will need a blunt fill needle with filter. Packaging is intact and it expires 9/20/26. I will need 2 pieces of gauze. 2 alcohol swabs, packaging's both intact and they both expire 11/20/23. I will need a given needle, so I have 2 sizes. I've got size 21 and I've got size 23. As my patient is quite small, I will be using size 23. Packaging is intact and it expires 10/20/26. I will also need a plaster, so I can see the packaging is intact, it expires 5/20/25. So I will take one of those, and I will need my injection. So as this glass ampoule, I can see that it's not broken anywhere, there's no precipitate. I have injection cyclazine, 50 milligrams in 1 ml, so we'll be drawing up 1 ml, and within date it expires 9/20/22, so I'm happy to use this injection. That's all the equipment I require, so we'll be preparing my injection now. So I will now prepare my injection. Before doing so, I'll apply my PPE. open. And release. So first I will clean my injection with an alcohol swab in a circular manner for 30 seconds. 1, 2, 3, 4,
30 seconds have gone.
Okay, and I'll leave it to dry for 30 seconds. So while that is drying, I will prepare my syringe and my needle. Making sure that I do not contaminate any of the key parts. So I assume it's been 30 seconds.
It's dry and ready to use.
Okay, so as it's glass, I'm going to use a piece of dry gauze to open up my ampule. And this will go into the sharps bin. I'm happy to withdraw. So as it's cyclizine, it's 50 milligrams in 1 ml. My prescription is 50 milligrams, so I'll be drawing up 1 ml. Making sure to get rid of any air bubbles. Get rid of any excess. I'm going to resheath. Examine it. Will you just confirm that I've got cyclizine and it's 1 ml?
It is cyclizine, is 1 ml in the syringe. Okay, great.
Okay, thank you. So before going back to the patient, I'll make sure that I change my needle. My given needle. Again, making sure I don't contaminate any of the key parts. And I'll dispose of my equipment, so any sharps will go into the sharps bin. Any rubbish goes into clinical waste bin. I'll keep my injection until the end of the procedure. And I'll change my ECG. Hi Emma.
Hi.
Are you okay?
I'm fine. Thank
Okay,
you,
so I'm
nurse.
back with your
Oh,
injection.
thank God for that.
Is that okay for me to proceed?
Yes, please.
Okay, before I do that, can I just recheck your identity with your
course.
wristband? Tell me your name
Emma Hartgrave,
and your date of birth
26963.
and hospital number K9523674. So that is the correct patient. And have you got any allergies?
No allergies.
Brilliant, and you've got white wristbands, so that is all correct. So we've decided we're going to give it into your left arm, so it's intramuscular injection. Is that okay?
That's fine.
Before I give this injection, I'm going to make sure that I follow the 5 rights, which is the right patient, right drug, right dose, right route, right date and time. So I'm happy that I meet my 5 rights. I'm going to do my hand hygiene. And apply my sterile gloves. So I just need to have a look at the site. So I'm looking for any signs of inflammation, any signs of edema, any signs of infection or skin lesions, and I can see the site is clear. Have you had any surgeries in this arm or anything?
No.
Okay, so I'm happy to use this arm to give this injection. Before I do that, I'm just going to clean your site with an alcohol swab. Circular manner for 30 seconds. Sorry, it's a little bit cold, Emma. 1, 2, 3, 4,
30
5.
seconds have gone.
And I'll let it dry for 30 seconds.
And 30 seconds have gone. It's dry and it's ready to use.
Okay, so you hold my dry gauze in one hand. Pop this down, so it's going to be bad on it. Okay, Emma, so I'll stretch the site. It's going to be a sharp scratch, okay? And let me know if you want me to stop. So we'll go at 90-degree angle making sure 1 centimetre it stays out. I will aspirate to look for any signs of blood. There's no signs of blood. And I'm going to give the injection at 1 mil over 10 seconds, as it's 1 mil, so I'll do 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Are you alright, Emma?
I'm fine, nurse.
And I'll wait for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Remove swiftly, and I'll just apply pressure, making sure I don't rub. Is that okay? You alright?
I'm okay. It was a little bit painful.
I'll make sure that I close my safety device. Sorry, Emma. It'll make you feel better.
I know.
You're not allergic to any plasters, do you?
No,
Are you?
I'm not.
Okay. I'll pop a quick plaster on you, alright. You alright?
I'm fine, thank you, nurse. Thank you for that.
You're
I
welcome.
hope my nausea will go away.
Hopefully, so you can have some lunch. Brilliant. Are you okay there?
Yes.
I'll just go get rid of this equipment. I'll just document, but I'll be around here. So my sharps will go into the sharps bin. My clinical waste goes into the clinical waste bin. I've removed my PPE.
1 minute and 16 seconds.
And I'll do my hand hygiene. And I'll document. So as it's hospital setting, there's no space for me to document the batch number, but I will document the batch number in the nurse's notes. So we've got cyclizine. I will sign. So it's due at 2 o'clock. Put my initials, and the date is 26/5/2022. Okay. So Emma, that's me done. How are you feeling?
I'm feeling okay.
Okay. Are you comfortable?
I am comfortable.
Do you have any questions?
No questions.
Okay, I just wanted to make you aware that with cyclizine you might experience some dizziness, some hallucinations, but this is very, very rare, so I wouldn't worry about that too much. But if you do experience anything, please let me know.
Oh, thank you, nurse.
Okay, so I'll be leaving you now, but I'll be back in 30 minutes to reassess and make sure that you're okay. Is that okay?
Thank you.
In the meantime, I'll leave you with your call bell, so if you need anything in the meantime, just use that to call me.
Thank you, nurse.
Okay, thank you, Emma.
4 seconds to go.
And finally, I'll stop with my hand hygiene.
And the time is up.